Obviously, once you get the basics, the family history and those things that I was saying, the medical history and all that. Once I find out what they want, I'll draw on what I think fits in with what they want and what I know can be done. Try to find pictures in my book that'll give them an idea of what they can reasonably expect. Critical that they have the right expectations. I mean, you can do the best work in the world, but if the guy's expecting this and he gets this, he's not going to be happy. So you want to make sure that what he's hearing you say or what he perceives you to be saying is reality, and that you can give him what he wants, or can give him that you can achieve his goals, and if not, get him to understand what you can achieve, and that is an acceptable level of care, and you got to get those two things together. So you work with that, show him pictures, hear what he has to say. Obviously, financial considerations. You might be able to say, hey, I can do this, this, and this, but maybe he only has a certain amount to work with. And I'm realistic. I'm not one of these guys that just says, this is what it costs, take it or leave it. If he tells me he has a budget of $5,500, then I'll tell him what I can do for $5,500. And if it's not enough to make him look good, we won't do it. If it's not enough, or if it isn't what he wants. But I don't make them fit into a little mold. There's some people have certain budgets they have to stick in, and I understand that. So it's a combination of getting his perceptions and mine on the same wavelength, financially making sure he understands the pre and post-op care, make sure he understands long-term what it entails. If he's 30, it may mean 10, 15 years from now he's got to come back and get another procedure. It may mean he maybe should take Propecia or Rogaine. So I incorporate all those things in, and then hopefully when the patient leaves, he has a reasonable understanding of what is or is not achievable.